All right, looks like we're recording. Ladies and gentlemen, we have something very different today. Just real fast, this is Gordon Einstein. I'm your local crypto attorney. We're not going to be talking so much about crypto today. We're going to be talking about some very practical information about how you can actively manage your health and wellness in a way that's systematized and proactive and brings you a lot of benefit quickly. So I have a very unusual guest on today, Dr. Nas al Jafari. Did I say that correctly?
You did. Full
Okay.
points.
Well, thank you. Welcome. I'm always mastering names, and I'm ashamed about it. But yeah, I did my best. Okay, so this is going to be just a fast-hitting, hard show because there's a lot of information here, a lot that can be done. I think eventually, everyone wants to talk to the doctor to get it implemented, but we're going to cover things at a high concept. So you said something really fascinating during the pre-interview, which is, us crypto types, us business types, we have a dashboard for our business, but we don't have a dashboard for our health. Now, what I'm going to do is I'm going to hand the conversation to you. Just interrupt when I feel like it. What do you mean like that? But what do you mean by that, and how do you implement it?
Well, first of all, thanks for having me on the show, Gordon. Been looking
My
forward to
pleasure.
this one. So, can't wait for this next 60 minutes.
And
Thanks for that
just real fast, who are you?
Yeah, good point. So, no, as you said, Dr. Nas al Jafari, I've been in the region for the last 10 years, and I'm a consultant physician, so medical. And I actually trained in the regular health system back in the UK originally. This ties into kind of what you're asking about, the sort of medical dashboard as well, in terms of my personal journey. For me, I kind of realized, good 10 years into sort of having qualified that the regular health system is too antiquated. It's not set up to deal with today's health problems. If you look back, say, 60 years ago, the things that people were dying from are very different to what people are suffering with and dying from today, yet the health system hasn't evolved. So if you look at that umbrella of, we call it metabolic syndrome or metabolic conditions, obesity, type 2 diabetes, cardiovascular disease, you can even put sort of autoimmune conditions in there, and the list goes on. These were things that people weren't suffering from in huge quantity, yet they're ever present now. And the solutions haven't changed. And I think, definitely
The solutions haven't changed, or they should have changed but didn't change. You mean still they haven't changed?
Well, so I think in the mainstream health system, it's not changed.
Okay.
And I think it's because we're stuck in this mentality of, a century ago or half a century ago, people were looking at illness in a sort of binary fashion. You had an infection, you give an antibiotic, either works or it doesn't work. You have a surgical problem, a cancer, you cut it out, you get rid of it. Whereas you can't take that approach to something like type 2 diabetes or obesity. There's many variables involved. You have to look at the root cause, and invariably lifestyle has caused the problem. So you have to use a lifestyle solution. It's not a case of just giving a pill, which is the system that we were stuck in. So as part of my own journey, I kind of realized that we weren't serving people well. We were shackled to some degree by that system. In the UK, it was the National Health Service, a publicly run system. So in order to escape from that, I had to, first of all, retrain, and secondly, practice in a system that allowed me to practice in a more forward-thinking way that addressed the current problems of today. So
you actually said something really deep, and I want to drill on it for a second. The antiquated approach in a socialized system, dare I say, like the UK, is enforced by government mandate. It's not just the doctors that are backwards. Even if they are forward thinking, it sounds like they can't do what maybe they're supposed to do because of regulation. Is that correct?
100% correct.
That's scary.
It is indeed, and I think certainly COVID for the masses has served as an inflection point, and really people have started to realize that maybe they're not being best served by that system and are empowering themselves, whether that be through sort of self-education or things like podcasts like these, where they're realizing that and seeking an alternative practitioner or a way of living well.
Wow. Okay, you're more of a rebel than I realized, but this is why it's good to do these interviews. Okay,
legitimized rebel.
No, it's great. So you came to this realization in the UK, and you had to come to a place where you could practice where you wanted to, and come to a place where you could retrain like you wanted to, and then go ahead.
Yeah, there really isn't a specific textbook out there. There are foundations that exist, foundational training. I mean, you will have heard of the term sort of functional medicine or integrative medicine, and the
Mhm.
funny thing is, a lot of these practices have been around for centuries. It's just that they're coming back in and being more formalized in a sort of modernized alternative
Okay.
practice and given different names, but we're essentially using a lot of centuries old practices combined with a lot of sort of more modern day developments. But I think fundamentally, the way we're looking at disease is just very different. It's, what is causing my high blood pressure? What is causing my high sugar? Rather
Mhm.
than just giving someone a medication to bring that sugar or that blood pressure down. It's looking at health in different facets. And people will have heard of people in the nutritional pillar, exercise, stress and stress resilience,
Okay.
sleep. And then I guess you could create another pillar of adjuncts or supplements or whatever it may be. So,
Now, sorry, you froze for a second there. The
and
four pillars are what? The the
so,
the the video got interrupted.
so 4 pillars are nutrition. And I guess within nutrition, it's what you're eating, when you're eating, how often you're eating.
Okay.
But then you have exercise,
Okay.
and then you have stress and stress resilience, and then you have sleep, and I guess rest comes as part of sleep. And they're the foundations of good health. I mean, you will see other versions where they'll add on relationships and spirituality, which I think for me comes as part of the stress and stress management. But that is increasingly becoming a more formalized pillar. And then the last pillar you could argue is also things like supplements and medical adjuncts.
Interesting. Now, though, what was catching my ear with what you just said is that stress is such a major component that it deserves its own pillar. Is that is it on par with sleep? Is it on par with exercise?
I think it's probably the foundation of to everything else. In that, if you're let's give you this example. If you're stressed, you're not going to sleep. You're going to crave the wrong foods, particularly also if you're not sleeping very well.
Mm.
You're potentially not going to have the energy to exercise. So I would say that certainly stress, and maybe even alongside sleep, underpins the nutrition and exercise. Whereas historically, it was really exercise and nutrition that were given all the focus and attention. And part of that was just because I think it's easier for people to conceptualize and understand nutrition. Everyone has opinion on it. We're surrounded by it in a more obvious way in our day-to-day life, and there's huge commercial industries behind them. Whereas there's definitely been a change of tide in the last, say, 5 or 10 years, where there's a lot more of a conversation around stress management, and sleep. It's become less of a taboo, and I think there's become a realization that it is as much of a problem, if not worse. I think I just
Mm.
also want to just add on one more point regarding that. Is it's not been something that typically we've been able to measure. I
Mm.
mean, it's one thing someone saying to you, "Oh, you're stressed," or having, a realization, "Oh, I might be stressed." But if it's something that's measurable and you can show someone something quantifiable or tangible, it's very different. And so there are some tests that exist, but they're far from perfect. So I think that has also been a problem. And then as a result of that, it's not really been something that's been clinically recognized necessarily by physicians for the same reason.
Which you're actually leading into a fascinating conversation, which is the word stress to me is, now that you're discussing it, is a little bit subjective. Like I know what my blood pressure is at any one moment in time, but there's not like a stress gauge that I'm aware of that gives you a number. Is that sort of what you're getting at?
Completely. And
Okay.
you're seeing certain metrics coming in now. I mean, you may even wear them yourselves, stuff like the Aura Ring and Whoops straps, and various other gadgets which can track things like HRV, which stands for heart rate variability, which is often used as a proxy for stress.
Okay.
But you're right. It is subjective. But I think that, also the biggest problem here is that our brain has no ability to differentiate between what is real stress versus the perceived stress that a lot of us are creating in our heads that necessarily weren't sort of part of the evolutionary stress equation.
Interesting. So if I come to you, and I think I will again, and I want to take your dashboard type approach being proactive and holistic and not foo-foo woo-woo, but like real up-to-date integrative approach. What do I do? What does that look like?
Yes, well, I think there's two sides to it. There's initially going through the sort of testing process and really understanding the various aspects of your health, and that could, it's personalized to that individual. But if I give you a kind of sort of 360 sort of global approach,
Mm,
it will be on one level having an understanding of someone's genetic and DNA predispositions, but certainly not looking at that in isolation. Genetics is very good at giving you context. You have to
mm,
then put that information with what we would broadly call your metabolic information. So that most people will know that as doing blood testing, but it often is beyond that. Certainly in our field, I mean, we're looking at everything from hormonal analysis, which can often be more detailed saliva and urinary profiles.
mm,
We can be looking at gut health. Obviously, gut health has been one of those sort of trendier areas in the last 10 years since the advent of the PCR technology. So we've developed a lot better insight in the gut, and also alongside that, the realization of the gut having a lot more of a role way beyond digestion. We can look at your gut health and your gut function. We're looking at cellular health. We're not just looking at nutrients or levels of chemicals within the blood, because what we've realized is that your blood levels don't always represent cellular levels. So
okay.
it's really building a picture with everything from hormones, genetics, gut health, mitochondrial health, inflammation, putting that together, and then really coming up with a personalized plan for that individual and tracking that individual. Because often what you'll find traditionally with people is they may go and do their annual medical, but then you don't see them for another year.
But by definition, almost.
Case in point.
Right.
Yeah.
Thanks a lot.
Uh,
Yeah. Well,
um,
we all come back to you one way or another. This is probably the way. Thanks for that public nudge. Let me ask you. I was actually talking to a nurse a couple of days ago by chance, and she made an interesting comment, which is people who are my age, dare I say, it sounds funny to say that, have a perception of the state of art of medicine, which is a bit outdated. And that the things that used to be hard to deal with, whether it's cancer or high blood pressure or this or that, are much more treatable now. And I couldn't tell if she was being Pollyannish or accurate. What's your take?
I think, let's take a step back. Yeah, a lot of people now want to just live longer. They want to live better, but they want to live longer. And part of living longer and better is eliminating your main causes of death. And your
Okay.
two main causes of death by far are cardiovascular disease and cancers. And so if you first of all look at cardiovascular disease, we now have the metrics and technology now where people who are high risk of cardiovascular disease at a very young age. And secondary to that, we now have the ability to treat people very effectively to bring that risk as close to zero as possible. So
Okay.
that's your kind of cardiovascular side. It's just most people aren't making use of that technology and that testing and also treatment, because again, they're being managed in a traditional system, and we can talk individually about sort of the faults of that and why people aren't being picked up.
Mm,
Um, but then also, if you take cancers, even now, I mean, I don't know whether you yourself have heard of these newer sort of circulating tumor cell tests that they've been in the headlines, certainly out of the US in the last few years. We now have tests from two tubes of blood where
mm.
you can pick up very early stage circulating tumor DNA. We have a test that looks at more than 70 cancers within that
Wow.
single test. So you can see between those two tests, you're bringing your risk of developing cardiovascular disease and cancer very close to zero. And I think that's what she's alluding to. I mean, you could argue sort of taking it sort of beyond that, that if you look at the individual factors, like high blood pressure that you mentioned, yeah, I
Mm,
mean, they're very treatable with generally for the most part through lifestyle, and if needed, supplementation. It doesn't necessarily require medication, but even if it does, there's a reason for medication. And if it's applied appropriate, then great, it's life-saving. I think the issue with the way medications often used in the population or on a population level is it's often overprescribed.
That's interesting. Is there an economic, I mean, we're going to get into all the conspiracy stuff, but is there an economic incentive in the system to overprescribe? Or is there time pressure?
Oh, that's a good question. I think it largely depends on the system that you're in. So if we come back to, say, a public system like the NHS I was working in before, a lot of the focus is, they say, is on cost effectiveness. I think a lot of it is more on cost and cutting cost. Doesn't necessarily mean that that treatment is going to be the most effective. It might be on a population of 10 million people, but not on an individual level. But then if you compare and contrast that to a US-based system, an Americanized system, which is very well known to be extremely high cost and not particularly high up in the outcomes data, unless you're in that population of people, that niche, who has very good health insurance and will inevitably receive the best healthcare in the world. People are overprescribed, and there are all sorts of forces at play, but yeah, it's a huge cash business.
Interesting. Okay, so let's continue the narrative. Like, I come into you do all these tests, you take me forward.
So then, the cornerstone is always going to be someone's lifestyle, and I think a large benefit of what people get from us is really cutting through the noise and giving them more of a scientific basis to that lifestyle advice. The problem, say, take nutrition, for example. The intermittent fasting, let's say, has been a kind of craze or something that's caught the attention of people in the last, say, 5 or 10 years. It's not just a case of a one size fits all. Everyone should do a 16/8 or a 24-hour food fast. These things need to be applied in an individual by a practitioner who really understands what they're doing, knows what to look out for, and knows what to track. And I give you a prime example. A lot of people go away and do that sort of approach, and they may lose weight, but they end up losing muscle, and so their body fat percentage goes up, and then they end up because they've just taken the headline and they've tried to implement it. And this is what we see across the board when it comes to a lot of these lifestyle sort of headlines that come out every sort of year or two, or even more often. So it's really giving people the right lifestyle advice. And then above and beyond that, we have a lot more of the sort of regenerative interventions, and that's everything from hormonal optimization. There's a whole area of which we can talk about peptide therapies, which are very big now. We have exosomes and stem cell therapies, which I'll put at the sort of the pinnacle of regenerative medicine. We have other therapies, light therapy, this cold therapy, this hyperbaric. You'll see these, I guess, other centers also popping up, and you'll know people and have friends. You may even have it yourself. People are installing these, in their apartments or their houses. Gone are the days where having a swimming pool is the cool thing to do. It's now about having the biohacking studio in-house. So
Studio.
These are things.
Not the room, the studio. Okay.
Studio.
Wow.
Yeah.
I have my YouTube
so it's
studio,
really...
and next to that, I can have my biohacking studio. Okay.
Indeed. So
you went through a litany of hormonal / injectables, for lack of a better word, that I kind of know but don't really know. Let's explore this a little bit. And you getting to the exosomes also. I've heard that bandied about, but okay, this peptide business, what is that?
So the peptide, literally, as the audience will know, just means a string of amino acids. So it's a protein. And what a lot of people don't know is that there are very commonly used peptides in everyday sort of medical practice. Insulin is a peptide. A lot of these kind of newer weight loss injections, the kind of weight loss craze now, are peptides. They're pharmaceutically branded peptides. Now, there are many other peptides, hundreds of peptides that actually were originally used decades ago and developed by the Russians.
Of course.
And they started to migrate to the US, I think, in the last sort of 15, 20 years. And more so, I think, have become a lot more popular in the last 5 to 10 years, certainly locally, regionally, because they became licensed. The funny thing is, paradoxically, in the US, a lot of them have had their FDA stamp removed, and unfortunately, it's very difficult to administer peptide therapy. We're very fortunate here with a lot of the regulation, but just to let me give you a rundown of what they actually do. So you have peptides that may help with lean muscle mass by boosting, say, growth hormone. You have other peptides that might boost testosterone. You have some that improve regulation of the immune system and resilience of the immune system. Some that help have cosmetic roles and help collagen growth. Others that reduce inflammation, help recovery. But you get the idea. The list goes on. And the great thing about these treatments is that they are very impactful in a short space of time, and they appear to be very safe in the dosages and cycles that they're being used. So, and relatively inexpensive for what they do. So there's been a variety, I think, of different forces at play that have now made them become a real sort of key in that regenerative and longevity space.
And I remember I'll share with the audience that I've been to, and I did NADS, I think it's called. Is that a
NAD,
peptide?
yeah, NAD plus, yeah.
NAD plus, okay. And what does that do?
So then NAD, adenine dinucleotide, has a long name, and this I think became this also has been around for decades, but I think it became a focus of the public when you had a lot of high-profile scientists talking about how when they applied NAD or their precursors in certain animal studies, they saw improvements in health and lifespan. You then started to see it pop up both in oral form, so the precursors, people may know it by the shortened names of NR, nicotinamide riboside, and NMN. Nicotinamide mononucleotide. I can't remember off the top of my head. There's too many to remember. Yeah. So they're in the oral form, and then the form that the clinics are generally using is the IV form. Now, the reason why people like the intravenous form is that there is this improvement in cognitive and physical health that often people will see only with the IV infusions. Really? That they don't get with the oral precursors. Not everyone, but certainly the people who are coming for it more repeatedly are really justifying that spend through that improvement that they don't get with the oral forms.
That's very interesting. And then what's with the new stem cells? You use the exomer, or what's it called?
Yeah, so there's this thing's called exosomes, and then there are stem cells. I think people will be a lot more familiar with stem cells. And stem cells are applied through a variety of different means. Stem cells can be injected topically, whether it be for cosmetic reasons, can be introduced into a joint if you have a musculoskeletal problem, or some people are doing intravenously, again, as a kind of general overall play on the body, also associated sometimes with longevity because of its effect on potentially slowing age and through its impact on inflammation. And I think it's important for me to sort of inform the audience how stem cells work, because there's often this misconception that, oh, I'm injecting a stem cell, and if I have a problem with my knee joint, it's turning into the cartilage and the bone and it's healing that way. It's not having that effect. The stem cell itself is not turning into the local tissue in the area that it's targeting. The stem cell is exerting an effect on the environment that it's targeting. So that's largely through reducing chronic inflammation, which we know is a big part of aging, but then it is also influencing positive aspects of the immune system and allowing that infiltration, we refer to as kind of cytokines, into that area to allow healing and regeneration. And as part of a wider...
Actually, can I jump in, because you're explaining something I think you're clear about, a misconception I had. So the stem cells don't actually... They're forget this from high school, but they're plenipotency. How do you say it? Like, I was under the impression that stem cells can become any other cell.
So there are stem cells. Exactly, they have the ability. They retain the ability to turn into any other cell under the right conditions. So I think that's an important point to make. That the conditions that you're injecting, say in these circumstances where you're injecting a stem cell, they will not turn into that matured cell that you're talking about, say a fat tissue or a collagen or bone, for example.
But they are influencing the environment such that the areas that need some help have a chance to recover, is what I think I'm hearing.
Exactly. Completely correct. Yeah.
And so go ahead. This is interesting.
So that's a very popular area of regenerative medicine. And then kind of one that's become more sort of practiced recently or in recent years alongside kind of stem cells and as part of the protocols are things called exosomes. And the best way of explaining what exosomes are these are small fluid-filled sacs that are a byproduct of stem cell production that exerts some of those effects of stem cells. So you're probably thinking, well, why would you do exosomes if you have stem cells? There does seem to be a synergistic benefit. So, for example, there are occasions where we would use just exosomes by themselves before we try necessarily going full honk and applying stem cells, or we'll use them in combination where the exosomes prime the body for the introduction of stem cells. I think lastly, we often use them as well because exosomes can cross the blood-brain barrier, whereas stem cells don't.
Oh,
So
wow, that's fascinating.
you will not exert a direct effect of the stem cells within the actual brain. You may indirectly because you're calming systemic inflammation in the whole body, but that's an area where we also use.
So can you actually regenerate brain tissue? Well, since you can't cross a barrier, what then happens?
Well, so I mean, your indications that you're using the stem cells for can be any number of reasons. So, for example, some people, as I said, may just use it for longevity in general. Some are using it for specific joints or areas. Now, we would never say to someone, "We're able to regenerate your brain tissue with stem cells," because quite clearly that's not the case. We think that through the exosome usage, we're having a direct effect in reducing inflammation and improving the healing environment and regeneration. To what extent, it's difficult to say. But I guess anecdotally, what I can tell you is that there are certainly people who are using it for neurological applications and are seeing improvements.
Interesting.
So,
So
but you
this
can
is
never
really
turn
coming in.
around. Yeah, you can never turn around to someone and say, "I'm definitely going to say cure your Alzheimer's." We're not at that point. We're not at that point yet. Do we see an improvement in some people's symptoms and signs post-treatment? Yes, of course we do, and there is probably an impact on the overall speed of development. But we're not yet at that stage where we're really, I think, doing true cellular regeneration right now.
Is that in our, is it moving fast like artificial intelligence, or is it moving slow like self-driving cars?
Well, it depends who you speak to. I think that there are some scientists who are very bullish in the area, who I think are probably making it sound like the technology exists now or isn't that far off, i.e. 2 or 3 years. I don't think it's that close. I think we're talking at least another sort of 10 to 20 years. I think if we're looking at sort of full-on regeneration of sort of tissues and organs in the mainstream, we do currently have certain cell therapies or gene therapies where there are certain injections that can exist. I mean, there's a popular one now called follistatin that inserts itself and can improve lean muscle mass and also will, as part of that, is helping burn fat. And there's decent amount of studies behind that, and then that's something that's being utilized now. So it's in its infancy, but I don't think we're at that stage where it's a case of you turn up at the doctor, pay X, and they'll grow you a new liver.
Darn. Okay, well, I'll keep my liver in good shape for now then. How if you have, I think people are under. Let me put it this way: me as an American, I'm under the impression that FDA, the regulatory body, is capable and conservative, and maybe a little bit under the capture of the drug industry. But I don't think my impression from the outside, not being an expert, is that they're not a bunch of cowboys. And then maybe at the far other end of the spectrum, not to cast any aspersions, I think people leave the United States and go to Acapulco and Mexico to do the things that they couldn't possibly get away with in the US or Brazil, and it's kind of like their last Hail Mary before they go say goodbye to this life. And so there's this range of experimentation and regulation and enforcement. Where does it, if you accept my paradigm, and you might not, where does the UAE stand in this spectrum?
I think you summarized it very well, and I do accept that paradigm. Maybe with a slightly more cynical look at the or view of the FDA.
Maybe.
I think it serves a purpose, but I think that purpose, as you alluded to, is limited. And I think a large part of that comes back to this antiquated system. We've come from this system which has also, served its purpose very well, whereby everything is based around evidence and, preferably at the peak, double-blind randomized control, multi-center studies that
Mhm.
have been, replicated. That's, what's considered to be your highest level of evidence. But as we're seeing with health and medicine, how we look at biology is, I think, oversimplified and I think outright wrong. I think we have a very poor understanding of a lot of aspects of biology. I mean, I want to give you an example of that's what autoimmune conditions are. They will kind of just say to you, well, it's a dysregulation of the immune system. We don't know what's triggered it. That creates these sort of subjective symptoms and signs. For me, that's not, we're at a stage in science where we shouldn't be describing things like that. We need to have proper tests, scientific, real sort of understanding of what's going on. And I think we just have huge blind spots. And I think worse than that, there's a lot of unknown unknowns. And unfortunately, you have this attitude within the health system, which you probably have in other sectors as well, where if the test doesn't exist for it or it's not in the textbook, it can't exist. Whatever you're experiencing, it must be in your head, or I don't know, change your lifestyle and try and live around it. There's so many gaps in our knowledge, and I think a lot of it is not going to get teased out with that traditional structure of looking for evidence in the way that we look at it. I think we're moving into more of a precision medicine era where we're having to look more at our mechanistic understanding of drugs and therapies, which I think will be assisted a huge amount by AI and machine learning over the next, say, 10, 15 years, just because, they'll be able to crunch data and see patterns that the human eye or ability just won't be able to see. So I think there will be a change in our understanding of a lot of biology. And I think to tie this into what you're asking about the FDA, I think a lot of these treatments like peptides and stem cells and exosomes are at that cutting edge. They may not have been shown up to the level of evidence that the FDA necessarily would hold it to, but that doesn't mean that they don't work. So absence of evidence doesn't mean evidence of absence, is what I'm saying. So
I heard everything you said, but you sort of gently slid around my question of where does the UAE stand on that spectrum?
okay, so let me tie in that aspect. So the great thing about the UAE is that we believe, well, they have been more, we think, forward thinking and accepted the level of evidence that is behind a lot of these therapies as a stamp, or certainly they see the benefit and upside to utilizing the therapies and have allowed a lot of those therapies to be administered or practiced by the physicians in the UAE. So that's why now, for example, look at stem cells. There's very few places around around the world that you can do stem cells. You will know of friends and colleagues who will fly to places like South America or offshore US, Thailand. UAE is one of those places, and if, in fact, okay, there's obviously an implicit bias here, but it's a very well regulated place, as you know, in anything. And we have the best stem cell labs up there in international best practice, that is really sort of cutting edge. And so what we're
Actually,
seeing is,
you're implying something I want to make sure that it's the case. You're implying that the stem cells that are used for treatment are manufactured in the UAE, not necessarily imported. Is that true?
well, so our supply of stem cells are all within country, and then yes, they are purified, extracted, grown also within the UAE. And it
That's
is
pretty
an
impressive.
yeah. I mean, we have that technology, and I would say that the problem also with stem cells, like many aspects of healthcare and other industries, is it's become hugely commercialized. And there are various kind of buzzwords that a lot of these clinics will use as part of their marketing tools. Yet, like anything, you're not comparing apples with apples. So, a stem cell, say, that we give may not necessarily be of the same quality as a stem cell that's from another jurisdiction. We just know that our stem cells are grown and stored and tested to the international highest standards. Doesn't mean that that's going to happen necessarily.
Yeah, so the lawyer to me wants to tease this out. So I understand. I now understand something I didn't understand before, which is that stem cells are, for lack of a word, manufactured or cultivated within the UAE. That's new information for me. What, as a general, not you, but as a medical practitioner in general, can you also import them, or must you use locally produced stem cells?
So in theory you can, in theory and practice you could, but as a regulation, because it's a regulated industry, we can't just bring in stem cells from abroad. I mean, first of all, we don't have the need to, but no, we're not allowed to. Our stem cells have to come from a regulated licensed laboratory within country. And let me take it a step further, because
Okay.
it's the extraction and purification and storage process that happens within the laboratory. The stem cell has to come from somewhere. So
Yes.
the stem cell sources that we are using are cord stem cells or young, healthy, pooled donor stem cells. Okay, now in different countries, they utilize different types of stem cells. Again, the one that you hear most of the buzz about are the umbilical cord stem cells, because they are, in the studies shown, certainly in some respects, to be more effective, not always just by themselves. But they are the youngest, sort of freshest form of stem cells. So that's the one that people tend to talk about more.
Wow, this is a fascinating area. Okay, so we're kind of going down the litany there, but you had your peptides, you have your stem cells or your exomers. Am I saying that correctly?
Exosomes. Yeah.
Exosomes. Thank you. What else is in your holster that's cutting edge?
So
Or your quiver, not your holster. I'm forgetting my English.
So yeah, I think probably one of the most sort of exciting things that we it's not in house yet. We're lining it up. It's being imported currently as a concept. It's concept or a machine that does what's called plasmapheresis. It's effectively cleaning your blood. Some people describe it as almost like the dialysis for people without kidney failure. So it's getting rid of the toxins, those inflammatory complexes and cytokines that we said also contribute to aging, pathogens. It's a systemic sort of cleaning of the body, and we think that combined with the other therapies is really almost the holy grail right now in terms of treatment.
And then how often does one do that?
So the protocols, it's something that you would do up to twice a year. So you would do a couple of sessions of that every 6 months, depending again on your indication, but at least once a year.
Wow, that's fascinating. And are you scrubbing the entire blood supply? Is it a portion of it? How does that work?
You're literally you're hooked up to a machine for a few hours, and it's literally taking your blood through full cycles. You're doing full clean of the whole system, the plasma of the blood, which is the biggest part of the blood volume.
Who would have thought? Okay, that's interesting. I'll give the audience a reference that no one is gonna understand. But Ray Bradbury is one of my favorite science fiction authors. When I was growing up, he had a book, Fahrenheit 451, and there was a scene in that book, and this book is written in the 50s or 60s, where I think the protagonist's wife overdosed or did something, and so the ambulance came and cleaned her blood. They put it through a whole process like what you're talking about. The next morning, she wakes up all rosy and happy. And at the time, this was science fiction. I read this when I was in high school, and here I am in 2024 talking to you in Dubai, and I guess this is a thing. So it's wow, that's fascinating. Yeah. Do you feel different after you did this, or is it more subtle?
You do. But it's subtle. It's a little bit like the kind of the stem cell effect in that, we've had many people go through now, and the positive effects, given that, we're dealing with a lot of people who are already health optimized, the effects can be anything from I'm sleeping better to my mood is better, my recovery is better, energy is better, less aches and pains. It's something that can have a pretty sometimes quick effect, so within days, up to 3 months.
Up to 3 months. That's actually pretty fast. Interesting.
Yeah.
How does it work in terms of neurological issues like autism or ADHD, or it seems like everyone has something these days? And you go ahead.
Yeah, I think autism and ADHD are interesting in that you're right. It's a lot more commonplace now, and again, I think the cynical part of some people will say that it's. I think it probably is or overdiagnosed in certain quarters, but there is definitely an increase in volume of people suffering with behavioral problems that could broadly fit into those two categories, either as a child and or as an adult. And I think a large part of that is, well, first of all, people's genetics haven't changed. We all have the same genetics as we had 5 generations ago, but our genetics are being brought out because our environment has changed, and a big part of that environment is toxin exposure, where less the food we're eating is less nutrient dense. Our guts are not as diverse as they used to be, and that's having a role in influencing our neurological and immunological health. We're under a lot more stress emotionally. We're under stress as we're underslept. I think there's a variety of different forces at play that are bringing out a lot of these symptoms and signs of things like ADHD and autism.
So you're making sort of an epigenetic argument, I think.
Exactly.
But my question is the peptides, the stem cells, and the varieties of it, and the blood cleaning thing you mentioned, just in general, is that something that one would do for a neurological issue, or is it more somatic? I don't know if I'm using the right words.
No, you're right. It would help. I think you're probably trying to what you need to differentiate between is whether psychiatric behavioral issue or more a neurological, as in physical issue with the brain. I think both. An area that we're seeing big impact on people's mental and neurological health is actually just supplementation.
Okay.
So, and it comes back to this point of, our people aren't now getting the nutrients that they require to allow the conversion and detoxification of certain neurotransmitters. At the same time, they're not dampening the inflammation, and the inflammation is causing problems, inflammation within the brain. So if you're then identifying those people through their genetic predispositions, we call them genetic SNPs, their DNA, and then also you're seeing biochemical imbalances with their blood testing, we're then using that data alongside their symptoms and signs to sometimes even just putting people on something as simple as a B complex. I mean, I've had it already twice today. A lady who had a collection of symptoms of anxiety, OCD, poor reaction to antihistamines, a lot of allergies, fatigue, and literally just through giving her a couple of over-the-counter supplements, she feels completely different. It's transformed her life.
See you next week. It's been a while. See you next week. Wow. Interesting. And actually, we kind of left it out there because the fifth pillar you're mentioning, or the fourth and a half pillar, was the supplementation. And what I'm hearing is you're doing. I think what I'm hearing is you're doing the genetic profile. You're maybe also doing the blood test to find out what's actually going on, and then you're recommending the appropriate cocktail. Yes.
Completely. Exactly. And this is something that some of your listeners will have heard about. I mean, there's been a few voices speaking about genetics and genomes, and particularly methylation is a concept that people have been talking about, and everyone's ringing us up wanting to check their DNA methylation. This is a prime example of that. But what I would say to the listeners is it's no good just checking your DNA methylation. You have to pair it up with your metabolic information, because you use the terminology, it's the here and now, not just what's loading the gun. And when you have that together, that's when you can put in the right supplemental protocol. Now, I don't want people to walk away necessarily thinking that it's going to solve everything, but in certain circumstances where you see these symptoms and signs, there is definitely a trend where nutrition, just something as simple as nutrition through supplement form, can improve those symptoms.
That's interesting. Now let me ask you something personal or more business related, I guess. Maybe it's the same thing. I met you a couple of years ago through a reference of a mutual friend, and I've noticed your wellness centers, I think, seem to be popping up in multiple locations. I think you're on the upswing. Can you, let's step away from health, even though I know it's related, and maybe talk about the course of your business or your practice and where it's
Yeah.
headed and what you're doing?
Yeah, gladly. So you're right. Yeah, I think it was around 2.5 years ago, and it was funny. I alluded to this earlier. I think you can divide our business into two time periods:
Okay.
pre-COVID and then post-COVID. Pre-COVID, it was a lot more of a tough sell in that you either understood what we did and you came and found us, or
Yes.
you just had no clue what we were doing. But then what happened with COVID and various forces at play, I think a combination of that traditional medicine, also medicine not having the answers for a lot of the conditions that people wanted
Yes.
to deal with, people wanting to health optimize, not just deal with sickness, but then also the economic environment and the sort of geopolitics here. You saw a significant population or swing in the population where many people from Northern America and mainland Europe have moved here. And it's people, very discerning people, highly educated. They have the resources and ability to access these sorts of health services, and unfortunately, the supply isn't there on the supply end. So we have developed or ridden off the back of that wave, and we're growing both within the UAE and we're soon going regionally within the GCC and internationally. Because even if you look at the sorts of services that we offer internationally, it's actually few and far between, even in somewhere as mature as the US economy. There's definitely pockets of it, but usually what you'll find is that it'll be one center. It's not been brought in on a big scale, and that's something that we're really trying to scale up.
Oh, I think you're well deserving of success. I'm happy to see it. So congratulations. Good
Thank you,
job.
Gordon.
And
Appreciate
I,
it.
from the heart, I mean it. Are you going to Saudi? Can you say?
Oh, definitely eyeballing Saudi. I mean, who isn't?
Okay.
Who's based here regionally? I think a lot of it though comes back to that point about regulation. So for us, it's you can cut and paste the bricks and mortar quite easily, the operations, the products. It's whether the regulator is ready for it in that jurisdiction, and I guess that's probably the same in a lot of what you do.
Sure.
We don't want to end up somewhere ahead of the game. Our services are limited, and we're trying to swing or influence the regulator for 4 or 5 years, because that's just not a viable business model. But we'll go into markets where we feel there are forward thinking, like the UAE, and hopefully get in there earlier, because there is a huge demand for it.
So, if you were to, so just hypothetically, if Saudi wasn't quite as permissive as UAE, but was fairly permissive, you could open up your offices there, offer what you can offer, and then say, by the way, in UAE, we also offer this. And it's not physically distant. It's,
Yeah, so feeder.
yeah. I mean, but maybe more than a feeder, like a value adding feeder, a place that can provides what it can provide, which may be enough for a lot of people. But if there's an extra part that, maybe it's the stem cells where you can only do in UAE, just let them know.
Exactly, and that's probably what will end up happening. I think yeah, as long as there's a threshold of what we can offer there, rather than just a skeleton service, then it'll be full steam ahead. Because yeah, as you know, the
Huge market.
population's 10x, huge market. And there could be many clinics. It's definitely in the foresight.
Wow. Okay, I'm gonna check in with you in 2 years. I think I need to see you personally before then. I'll check in with you in 2 years, and we'll check in on your 50 global locations. That'll be amazing. Is there any? I mean, this is actually no. I'm sorry. I did have one other question. We were talking about a dashboard. Do you actually have a dashboard, or is anything like a dashboard for health, or can you? Is there a visualization tool of some sort?
Yeah, so I think it's a case of, you know, what are the main parameters that we're looking at to track someone's health and longevity. And you know, part of our health screening reports, you know, they are far more detailed than just the typical sort of data dump that you would get. You know, a 12-page list of bloods on all different pages. We have, you know, year-on-year comparators. You know, there is a, you know, engine behind the data that gives risk scoring and areas to focus on. So real sort of lifestyle planning. So we have our own in-house dashboard that we do with people who are doing health screening.
Wow, that's really interesting. Okay, you know what? We wanted to make it 1 hour, and I think we did it. Don't choke on me. You gotta my good doctor here.
You
Okay.
finished to the right point.
I think I finished at the right point. Okay. Dr. Nassim, thank you so much for doing the show. I love it. We're gonna publish this soon. I'm gonna stop the recording, but that was great. Thank you. 1 second here.